She needed to be able to feel like a human being. She needed to be able to be comforted by simple things, a smile, company. She didn't need major tubes and drains. She just needed somebody sitting there with her so that she didn't feel alone. And that's really what the VA was able to provide for her.
The team was absolutely magnificent. The support that they gave my husband and myself was unbelievable. All of his care at the VA was really nurturing and caring care that they gave.
Being in the VA was what my dad wanted. He felt at home here. The VA was a big part of his life.
I hate to say it, but it was a joy to come here and visit him. I don't think of any other place I'd want him to be.
The Grieving Center has come to the VA New York Harbor healthcare system because in many ways the VA sets the benchmark and influences healthcare in the U.S. This is particularly true in the area of palliative care, or care at the end of life, where the VA is also setting the gold standard. We have been privileged to interview an entire team of dedicated professionals who provide palliative care, and to speak with a number of family members of the veterans who have received this excellent care.
My name is John Donnellan. I'm the director of VA New York Harbor Healthcare System. VA New York Harbor Healthcare System consists of 3 major campuses. Our campus in Manhattan on 23rd Street and 1st Avenue, and our campus in Brooklyn, both of which are acute care facilities. And then our St. Albans campus here, which is more of a long-term care center, although we do ambulatory care at all sites. And then we have a number of community clinics. What we offer is comprehensive care to veterans throughout New York City. We also serve as a referral center for cardiovascular and neurosurgery in the greater New York metropolitan area and even southern New York State and central and northern New Jersey. Veterans Administration is not part of the Department of Defense. It's a cabinet-level agency. There is a Secretary of Veterans Affairs. There are 3 components to it. The Veterans Benefits Administration that administers a system of benefits, whether they're pension benefits, whether it's compensation for injury sustained in military service, whether they're GI home loan guarantees, other education benefits that veterans are entitled to. There's the National Cemetery System. And then there's the Veterans Health Administration. So it's one single system, the Veterans Administration, actually the Department of Veterans Affairs, we're one component of it. The history of Veterans Health Administration is really traced to President Lincoln's second inaugural address in March of 1865. Lincoln, speaking to the nation as the Civil War was growing to a close, spoke about the war, spoke about the causes for the war, what led us to war, how the nation, his vision for how the nation would heal itself, mend itself after the war. But he closed the speech asking the nation, in his words, to care for him who shall have borne the battle, and for his widow and his orphan. And that really forms the basis of the Veterans Health Administration. It wasn't called the Veterans Health Administration then, and it was really a series of soldiers' homes that existed throughout the country. The military operates its own series of hospitals. Bethesda Naval Hospital is a naval hospital. Walter Reed Army Hospital is an Army hospital. The Army has, and Department of Defense have narrowed down the number of hospitals they operate, but they still operate hospitals in the United States and some overseas as well. But their principal purpose is to serve active duty military personnel who need care in those facilities. The VA's principal purpose is to provide care for veterans, people who have served their country honorably and are entitled to medical care.
Our patients are very special in that they are veterans. They come with a very different background. They come with a very specific background. We like to think of them as heroes. And their needs for bereavement, for palliative care, for hospice care, for grieving, in some ways they are the same as anyone's, and in others they're very different. The veteran population is generally thought of as being older, sicker, and poorer. And that brings with it very different needs. There are a number of our patients who have no family, who have no significant other, who may not have any living relatives, and whose friends and colleagues may no longer be available to them. That creates a whole different set of needs for that patient.
In the past 5 or 6 years, the VA has made a major effort to improve end-of-life care in the VA system. And by doing that, they've become aware of a lot of issues that did not previously come to the front.
One of the characteristics is many of our veterans have post-traumatic stress disorder. And as you get closer and closer to the end of life, the post-traumatic stress disorder resurfaces and sometimes has to be seriously addressed.
And we've made a real effort to learn about it, to involve our mental health providers, both the psychologists and the psychiatrists, in helping us take care of these patients, in recognizing it, and in recognizing that when patients are physically or emotionally very ill, very often the PTSD can get worse, can reemerge, and it has to be identified because it's treatable.
One of the things that's very interesting to get into and very helpful for the veterans is to ask them about their service, about whether they were in combat, where they were, whether at this point they're reliving it. And it's amazing the number who do start reliving. Everybody they know who's died, every time they were in battle, they start remembering it. And it usually helps them to talk about it. And they seem relieved to be able to finally talk about it. And sometimes it's the first time they've talked about it. But they feel safe talking about it here because we deal with veterans and they know we respect them for what they do.
Palliative care is something that's very close to my heart from both a personal and a professional standpoint. Palliative care is something that some folks would define as what you do when you can't do anything else. I prefer to think about palliative care as redefining success. Success in palliative care means that we are making the patient as comfortable as possible for whatever time that patient has, be it short-term, be it long-term. Success in palliative care means that we're allowing the patient to participate in their life as much as they want to.
I think that the VA offers something different, something more than most people get. Most hospice patients, if they need to be admitted to the hospital, are limited in what they can get, or if they need chemotherapy are limited, maybe radiation therapy are limited because most hospices can't provide that.
Palliation means to relieve symptoms, whatever they are, whether they're physical or emotional. And palliative radiation is very effective at relieving pain due to cancer, particularly when it's involving the bones. And palliative chemotherapy can be very effective at relieving other symptoms as well. For example, a patient with lung cancer who has a cough, chemotherapy may be able to help him. It also may be able to shrink the tumor and put it in somewhat of a remission so that the patient just has a much better quality of life and just feels much less fatigued and much more comfortable.
How can we manage their symptoms? How can we bring them to the highest level of functioning that they want? What's important to them? Pain control, family relationships, being able to participate in some things, being able to say no to some things.
We are very fortunate in the VA at the moment because at the moment the Veterans Administration is really supporting palliative care. Over the last few years, we now have that every VA hospital has a palliative care service. Some are more active than others. As we go forward, we're getting more and more what we call hospice veteran partnerships, which is where the VA hospitals pair up with the local hospices and provide care for our veterans together.
So the notion of providing these services is not just a nice, it's a need. It's not something that should ever be thought about as a frill. My father passed away almost 4 years ago with home hospice, and he was able to die with all of us standing around his bed. And I don't think it gets any better than that. We were very sad to lose him, but we knew that we had taken him all the way, and we knew that we had gotten him safe passage. And that has meant an awful lot to us. How do we make sure that our patients get what my dad got? It's an important mission. It is something that is not necessarily talked about on TV shows. It's not something that you're going to see on prime time every week on Thursday night. But it influences people's lives. It makes a big difference. We're all going to take that journey, and we really need to make sure that someone helps us along that journey in whatever way we can.